Hello again, everyone. Good morning. This is day 9 of our live updates from Vine Health. As I say, the whole idea of this is to keep everyone informed about facts, not fiction, to answer questions or comments or tips from anyone, and just to sort of help you live healthier. So Vine Health is all about wellness. It's all about feeling strong and spiritually, physically, in every way. That's what we're about. I'm sorry I couldn't post a notice to say I was coming on at this time. I'm trying to sort of do this and then get off to work quickly and sort out patients and that. These are interesting times. This morning I really want to focus on wellness, and particularly on sleep, but I will take the questions I've had since yesterday. I haven't posted them yet, but I'll just read them out. I'll answer those questions. I'll give you some facts from yesterday, mainly from the UK and Nigeria. I will try and dwell more on the positive news rather than the negative. We already know there's plenty of negative news, so let's look at what we can do. A lot has happened since yesterday. The first comment I received was from it was in my inbox on Instagram, and someone was very concerned about NCDC and the call centers. They were taking the calls from the public. I can't find it right now, but what the general comment was that they were giving very, very inaccurate information, telling people who were exhibiting signs of COVID-19 to go and see their doctor. I mean, there could be nothing worse than that. So I would say that's the wrong thing. I saw the video of the phone call myself, and I really just think that it is unacceptable. I tweeted to NCDC. I didn't get a direct response from them. I got a response from one of their allies who says that they're trying to deal with it and that there will be a YouTube video about how to approach things, and we should search for the YouTube video. That's not good enough. Every government right now is under immense stress, and the least that we would expect from an institution like NCDC is to actually comment, to tell people what to look for and where to get the right information. So that was quite wrong. So I'll keep looking. I'm sorry for all those pings. I've been getting a lot of friend requests since yesterday, and I've accepted every single one of them so that we can get this message out. So please share the video for everyone who's requested to be my friend, and I've accepted. The whole idea is so that you share this video and people can keep getting accurate information. Anyway, so that's about NCDC. I will keep following up on any videos. I haven't seen anything. If you've seen any videos from them about how people should access them for help or support, please let me know, because I haven't seen it. But I'll check again today. The second question that I had was from another listener who said, is it true that the virus can be airborne for long periods with risk of infection without close contact? We live in the countryside and would like to go for a walk. I mean, I answered this question a few days ago, and I know that there's been a lot of discussion in the news that the virus can stay suspended in the air, and it's not evidence-based. It's not proven. I've looked at papers, tried to assess what people are saying. It's not true. It is airborne. It's transmitted by droplets. So for instance, if somebody sneezed and there was a waiting host, so you were there, you inhale the droplets that's come through the air, then that's the way of getting infected. It's also on surfaces, so that's why we say wash your hands regularly. So that wash your hands, maybe always just time yourself to wash your hands every hour. Wipe down surfaces, wash your hands, and just keep that hygiene clean. I just went out now to the shops. I bought a few things, and before I left there, I washed my hands before getting into my car, because you could pick it up from surfaces. So it's just when somebody will sneeze and then it will be in the air, and then while you are just minding your business, walking past at another time, then you will inhale it. That's not true. There's been some discussion about if you are doing something that requires aerosol. So for instance, if you're doing a dental procedure where you're pushing air forcefully or using a nebulizer, that could keep the virus in the air for a bit longer. But we're not doing aerosol generating procedures in the air while we're walking around. So that's not quite true. I think so. Are the 2 questions I'll take for this morning. Any other questions, we'll move it till tomorrow so that I don't bore everyone. But if you have any tips or any questions or any comments or any ideas or how you're isolating, let me know. Right. So what has happened since yesterday? It's been really interesting since yesterday all across the world. As you know, in the United Kingdom, there's now total lockdown. The death rate has gone up, unfortunately, and it's now, from last time I checked, at 335. So it went up by about 46 or 48 yesterday, and it's gone up, and the positive cases have also gone up. So hence, we're now on total lockdown for the next 3 weeks. So if you're a medical personnel, obviously you're going to go to work. But again, even the medical personnel, many of them are having to be at home because they fall into the high-risk category. If you don't know what that means, if you watch the video from day 8 yesterday, where I've explained all the different categories of the high-risk groups. If you're in a high-risk group, you have to be at home for 12 weeks. You have to be shielded for 12 weeks. That's if you're in a really severely high-risk group. So, so even the medical staff, there's fewer and fewer of us available for work. So we're all having to come together to provide care for patients. So lockdown in the UK since yesterday, and that's the way it's going to be for the next 3 weeks. What else has happened? And in Nigeria, obviously, people are taking it a little bit more seriously. Unfortunately, people were still going about even yesterday. Even in England, people were still going about yesterday like nothing was going on. So there's now been lockdown. Nigeria obviously has shut its airspace. All flights cancelled. For those of us that like to travel, well, that's not going to happen now. Nobody's going to let you in anywhere. So stay home. You can't go anywhere. I mean, there are planes that are flying empty with maybe one person or so. So again, also in America and the United States, the positive cases have gone up as well a lot. And the death rate is over 500 as well, which is a bit sad. I mean, we don't even want to talk about Italy. Italy is going through a lot now, and we just pray that we can stem this as soon as possible. Right, so those are the updates from yesterday. Now, I'm going to focus on wellness. As you know, Vine Health is about wellness. We do a supplement range. I'm very keen on vitamin D, vitamin B, and all of that. Obviously, we can't ship outside the United Kingdom now, but we can still ship within the United Kingdom. So if you're interested in supplements, particularly vitamin D or vitamin B, that would be really important. If you're also a wellness company or you're an organization that does, you know, any sort of business and you want to sort of come on board and partner with us and, you know, just sort of help to push this news out, send me a private message either on my Instagram or that's Vine Health on Instagram and Vine Health on Facebook. Now, today I want to talk about sleep. We're almost finished now. We have another sort of couple of minutes. So about wellness. I've been telling you all since the beginning of this live updates that you must turn off your phones and turn off the news. Otherwise, it will affect your health. Even if you don't know that it's causing you stress, you might not be aware that you're stressed, but if you continue to fill your consciousness with the negativity, it will affect your health. And this will pass. This will be over one day. You don't want to then end up with a chronic disease that has been filled by stress during this time. So my recommendation is that you shut off your phones, anything that is giving you this negative feedback for at least 10 hours a day. I mean, I shut everything down from about 7 o'clock. So any news I'm giving you, if it's not accurate, I'm sorry, because I get onto the news for an hour a day, look at what's happening, and then I shut it down after that. Turn off your phones. Turn off the TV that is constantly in the background telling you about people that are dying and how people are getting infections. And then reach out to somebody. If you're struggling, I have had several people contacting me saying that they're depressed, saying that they're feeling very anxious, saying that they're exhibiting signs and symptoms of COVID-19, even if they're not experiencing it. So my suggestion is that spend that time in contemplation, in reflection and meditation. Get out that project that you've wanted to do all these years and start to do it. I wish I could sit at home and focus on writing my book. I have to go to the office and I have to go and see patients or at least call them. You know, now that you have that time, get that thing that you want to do and really focus on developing it. If you're struggling, speak to somebody, call people, use the different resources that are available out there. I made a recommendation a few days ago as to apps that you can use for meditation, for relaxation, for deep breathing. If you breathe deeply and you're very conscious of your breath, you'll find out that you're less stressed. And you must sleep. One of the biggest influences on your health is your sleep. Try and achieve 8 hours a night. Try your best. I know you might say you don't sleep for more than 5 hours, but try. Sleep at this time. Give your spirit and your mind rest from all of this negative news. And I think that's everything that I wanted to say today. Okay, yeah, I was going to say one more thing, which is about the evidence of hydroxychloroquine and azithromycin. There's been lots of trials going on about 4 different medication now to see which ones will work for COVID-19. I'll keep you posted if you're interested in hearing about the effective medication, but there's been a few, including remdesivir, interferon beta, chloroquine, hydroxychloroquine, azithromycin, that have been trialed in different places, but we don't have enough strong evidence yet. The samples have been quite small, so don't go and buy any of this medication over the counter or anywhere. It won't work. And can I just say a big thank you to all the doctors and nurses in the United Kingdom and elsewhere in the world who were retired and came out of retirement to come and help. I just want to say kudos to you. Thank you so much for coming to help us because we are struggling. You're very, very much appreciated. If you can help, please continue to help. This has been a long one. I really enjoyed talking to you all. I'm going to sign off now. Please continue to connect with me. Thank you for all the friend requests. I'll accept all of them. Come and partner with us. I would accept, anything that you can do to spread the word. I will accept it. And send your questions, your comments, your tips. Send me some tags, your pictures of how you are coping during this time at home. Any just funny ideas, anything that we can share with everyone, please send it to me. And I just look forward to coming back tomorrow and giving you some more updates and give me some feedback as well. Enjoy your Tuesday. Stay strong, stay healthy, and give something to somebody else today. Okay? Bye.